So welcome to Darling Buds. On the request of a subscriber, I'm going to take you through a normal day in the life of Darling Buds. How, when a patient comes, what is the interaction and what he should expect on the day of the consultation, on the day of the procedure, and the next day when he comes in for dressing removal and for instructions. Well, after an exhaustive online consultation, which could be through either WhatsApp, Skype, emails, or phone calls, the patient books his procedure. Well, he only books if online we don't feel the need for in-person consultation. If there is an in-person consultation required, the patient comes and we see if his donor area is lush enough for a hair transplant. And then we give him a date accordingly. It is not that you come today and your procedure can be done tomorrow, because we do only one case in a day and we are usually booked throughout the year. When a patient is booked for surgery, he is advised to come to the clinic one day before. Generally at 2 o'clock, because at 2 o'clock I am generally free from my involvement in the operation theatre. And that is when we do an initial consultation with the patient, go through his objectives, his goals, what he wants to achieve, and examine his scalp, do a trichological examination, and see how many grafts are needed to cover the area that we have decided upon. The patient also goes to a lab. He goes to our lab to get his various preoperative blood work done. If he needs certain other tests like testosterone levels or so many other tests for hair loss, he does them as well. So the patient then goes back to his hotel or to his home, wherever he stays. And we have a few rooms in the clinic as well. Some people may choose to stay there as well. And then the next morning, the patient reaches the clinic at 7 in the morning. And I personally go through the entire hairline design. And I go through how many grafts we'll be putting and where the placement will be. Once this is done and the patient agrees to our plan, because he's had one whole night to think over it, it is not rushed. We discourage patients from landing up for the first time on the day of the procedure because it might appear rushed to the patient. And personally, I'm not happy with the patient not having been given the time to think over the plan. Because unless he applies his mind, unless he discusses it with his immediate friends or his family, he will always have in his mind at a later date reservation that he could have tweaked his hairline a bit or raised the hairline a bit or added more grafts in the hairline rather than the crown. So we give him around 12, 14, 15 hours while he is resting in his hotel room to think it over. So essentially we have two consultations. I personally design the hairline at 2 times. One is one day before the procedure and the day of the procedure. And then I personally trim the patient's head so that I can have a feel of what are the good quality grafts, what is the safe zone, what is the permanent zone. Because unless you do not touch the patient, unless you do not feel the donor area, it's difficult to assess the permanency of one zone over the other. Once this is done, the patient gets a wash. Which city are you in these days?
In New Jersey or here?
New Jersey. There.
Well, in New Jersey, I'm in Lambertville. I've moved.
And is moved into the operation theatre, where I've already prepared the anesthesia drugs, and the patient lies in the prone position, that is face down, and the anesthesia process starts. Now, this anesthesia process is such that the patient barely feels the needle prick. We apply all the principles of minimal pain, painless surgery, through pressure, through temperature, through conversation with the patient, in order to allay his anxiety. We must remember that the patient might not be feeling pain, but because of his anxiety, which has built up over the last few hours or last few days before the hair transplant, can be in abundance. And this can translate into pain. So in such cases, we give mild sedation like midazolam, or sometimes a little higher. We have an anesthetist in attendance all the time, and he's the one who's controlling the vital parameters, the drugs, the sedatives, and he's monitoring the patient all through the procedure. So usually 99% of the patients do not feel a thing, and they're talking, they're conversing with me, telling me about themselves during this 2 to 5 minutes period when we are giving the local anesthesia. And then we wait for about 7 to 10 minutes, let the anesthesia take effect, let it settle. And once the patient's heart rate and everything is settled down, that is the time I start harvesting the grafts myself. It usually takes about an hour and a half to harvest about 3,000 to 3,500 grafts. And we harvest them using the anagen Q plus technique, that is in vivo preservation. Once the whole harvesting is over, the grafts are extracted from the donor area, in which they were kept soaked with copious amounts of ACell with PRP. So it takes about 20 minutes at the most to extract all the grafts and get them under the microscope for cleaning and for dissecting singles for the leading edge of the hairline. Meantime, I am busy designing the hairline. The third time that the patient is shown the hairline design, this is the time when he corroborates that the hairline that was designed in the morning is what we are working upon now. The entire exercise is to keep him at peace, because many people after the hair transplant feel that the hairline is not what was drawn in the morning because there's a little bit of swelling, or because the head has been shaved and there are no landmarks to compare the hairline with. You cannot alter the hairline now. So the slits are made. It takes about 20 to 30 minutes to make the slits. Slit blades are of different sizes for singles, doubles and triples. And there's a particular design in which we place the singles, doubles and triples to get maximum out of the available grafts, because they have to be strategically placed. Now this is the advantage of the modification of our technique over that of DHI or any other technique which is a modification of DHI technique. Why? Because in DHI technique, simultaneous extraction and plantation does not allow this luxury of planting grafts strategically, because the grafts come out randomly in singles, doubles and triples. We do not know at the start of the plantation how many singles we have, how many doubles and how many triples and how many fours. So this is the advantage of our modification over the DHI technique, that we know and we are in complete control over the strategic placement of grafts. So once the slits are made, the plantation is done by the team. The leading 2 rows is done manually. Why manually? Because of the curl of the hair. As you all know, every hair has a curl. If the concavity of the hair curl matches the convexity of the head, it will give a natural direction. If we plant, on the other hand, in a different manner, that is the concavity facing upwards, which usually happens with an implanter pen, because in implanter pen, we cannot judge the curl of the hair, because the implanter pen is loaded by the technician and inserted by the planter. So this is the drawback of the DHI technique and the advantage of our modified DHI technique, that is anagen Q plus technique, in which the leading few rows of the hairline are done manually. After the first 2 rows, we use our implanter pens, which we have been using for the last almost 12 years now. Our technique is different from DHI technique. Why? Because we use implanter pens only for placement, not for slit making, because we follow the lateral slit technique. The lateral slit technique cannot be followed by the implanter pen, because the incision of a needle is not linear. The incision of a needle is lunar in pattern. That is, it is curved. It is a crescentic incision. Therefore, we are using pre-made slits of linear nature, following the principle of lateral slit placement. So these are the essential modifications of my technique over the DHI technique, and various other modifications of the DHI technique claimed by many other clinics to be their own. Oh, we are not discussing that. We are just discussing my technique, that is the anagen Q plus technique, which is a variation or a modification of the DHI technique, taking all the benefits of the DHI technique and using it in my context, in my situation, the best way the technique with modification suits my practice. So the placement takes about 2 hours for about 3,000 grafts. It is to be noted that the entire procedure of placement should be over in 2 to 3 hours, because it is essential to reduce out of body ischemia time. Out of body ischemia time, if less, will reduce graft wastage, because grafts, when they undergo ischemia or lack of blood supply when out of the body, they start to die off. So this is very essential. How long your procedure will be has to be planned so that the grafts are inside the body within 4 hours of their extraction, or maximum 6. So once the grafts are in place, the patient gets a lunch break, and that's usually around 2 o'clock in the afternoon. And the patient waits in the clinic for some time, about 45 to 1 hour. We give him instructions. We moist the area that is planted, and then the patient returns to his hotel room or his home or the room in the clinic, wherever he has chosen to stay for the night. And he comes back the next day for dressing change and for instructions. And usually all my patients return home the next day after the procedure, afternoon. And the rest of the follow-up is online, through Skype, through WhatsApp, through email. And we regularly follow them up because this is the time of growth and there are so many doubts in the patient's minds. Though we have tried to allay those doubts through this video, which gives answers to about 100 questions that a patient would have in his mind, which I have gathered over a period of 10 or 12 years. So I will advise everyone who's undergoing a hair transplant to go through these 100 FAQs and become conversant with the care before a hair transplant. If you have any question about a hair transplant procedure, about whether hair transplant is meant for you, or anything about hair transplant in general, I will be very happy to answer. You can leave a comment below or you can drop me a mail. Thank you for watching, and I'll be back with another video about the technique of hair transplant, facts about hair transplant procedure, facts about hair transplant medication, facts about hair transplant care which you can relate to, which is honest and which is evidence-based. Take care.